back to Tuesday Tips with Dr. Vidal here at Pear Plastic Surgery, our weekly time to discuss different types of procedures and topics in plastic surgery and answer your questions. Today, I'm going to talk about a special topic that a patient of mine asked me to talk about, and I really appreciate the recommendation because it's a topic that I get asked a lot, and I think it's going to help you guys in the decision making of going through a BBL and also what to expect, okay? And it's basically talking about the different shapes, bodies. We talk about foundation a lot, we talk about body shapes, how does that affect your results, and how do we take that into account when we're talking about surgery goals? Do I need 1 round, 2 rounds, and am I going to look out of proportion like a vixen? I don't really like that, and all of that conversation. Okay, so I'm going to start by talking a little bit about what is the foundation, and I'll go through the different shapes and my usual conversation with patients when I'm doing the pre-op and talking about their goals, expectations, and how we tailor each surgery to each patient, okay? And then I'll take some questions, obviously, okay? So let's talk about foundation first. Foundation is a word that we talk a lot about. What is that? It's basically our body, our anatomy. Each one of us is different, okay? There's not one, even identical twins are a little bit different, We're all based on a different bony structure, different muscle mass, different fat layer density and thickness, different skin quality, okay? So it's impossible for one person to look exactly like the other one, no matter how much plastic surgery we do, no matter how many procedures we do, because of that foundation. The foundation itself is different, okay? And I don't see that as a bad thing. I think that's special. That's the beauty of it, right? We're all different. We're all beautiful in our own skin, and we need to embrace that and be happy with that. But understanding that some results are going to look different, and even though you're trying to achieve a certain goal, it might take maybe 2 rounds for you what it took another person 1 round, okay? So let me explain a little bit. This is a very broad classification that they use in the weight gain and weight loss classes to describe 2 main body shapes, okay? Obviously, they're not 2 body shapes. I don't know how many millions, body shapes, but this is like a very broad classification that encompasses in like groups, 2 big different areas of fat deposition in a body, okay? Which is the apple shape and the pear shape, okay? The apple shape, it's a person that when that person gains weight mainly in the abdominal region. So it's like rounder on top, and their hips and thighs are a little bit more constricted, focusing more that fat deposition in the visceral fat, which is the fat that is inside of our abdomen, inside of our muscles, okay? So we have the muscles deep to that, around our organs. That's where visceral fat is. So some people deposit more fat when they gain weight in that region, and also in the subcutaneous fat, but in the trunk. What's called in some of the medical terminology, the truncal obesity, right? Like all these areas, the one that accumulates more fat, okay? And we have the pear shape, or people that when they gain weight, they still, the trunk or the torso still is a little bit slim, but you see that the hips and thighs get very big and wide. So that's a very broad classification, but basically it's a very common way of describing the 2 body shapes. How does this affect results? Very dramatically, right? Because if your goal is to achieve an hourglass shape and you're going for liposuction and fat transfer and you have a pear shape, then you're starting in advance, right? You're starting with a foundation that is basically putting you in an advance of having a narrower waist and wider hips from the start. If you have a more apple shape or more truncal distribution of the fat, then to get this area to be wider than the top, it might need more than one round, and it might not even get to the point that is so dramatic. The problem with getting very wide hips in people with this body distribution is usually their thighs are not as big, okay? So if we go ahead and put a lot of fat in the hips, then the thighs are not gonna match. And you guys, most of you guys that have been following me have seen my results. I try to focus on getting you something that is proportionate to your body. It doesn't need to be that it's not noticeable, that it's not dramatic, that it's not curvy or volume, but it's proportionate. Something that the hips don't go with your thighs, it's really not proportionate, and even though you're gonna have, yes, a thinner waist and wider hips, it's not gonna look good because it's not gonna be in proportion with the rest of your body, okay? So that's one thing that is super important to keep in mind when we're looking at pictures, right? A lot of patients do look at pictures to try to get an idea of what is it that I like, what is it that I want, and just have a picture of yourself as well. Take a look at how thin is your waist in comparison to your hips, how big or small are your thighs, and have that in comparison to the pictures you're looking, okay? To the before pictures that you're seeing in whatever website. So if you see that the body shapes resemble a little bit, then you can get a better idea of those results in the long run, okay? The other thing that's different is if we take a look to the back side, right? Buttock shape, okay? So buttock shapes are a lot of options too, okay? We have a lot of different shapes, sizes, volumes. But in general, again, being very broad, there's usually 4 classifications that we put them in, okay? And that's this little diagram, okay? We have the buttock shape that is more square, which means that the deposition of fat is more in the upper hip and also the lower hip, and the transition from the hip to the buttock is more square, making it seem like that, more square, okay? There's one that is more round, so that you have volume both up and down, but the transitions are smoother from waist to hips to thighs, making it more round, okay? We have the upside down heart shape, which is that thinner at the top and more volume towards the bottom. So slimmer on the upper hips and then rounder and more volume on the bottom or hip area. And we have the V shape, which is tighter at the bottom and then wider at the top, or what you've heard in social media, people talk about the lats. Lats are the upper hip area and then more towards where our bony trochanter is, that's where the hips are. Lats is over here, hips is over here. And you can see this diagram. This is a very, cartoon-like diagram of a buttock, but basically resembles, this is the anatomy, and this is the cartoon-like representation of what a lats is versus hips. So basically, lats go more towards the iliac crest or the upper part of our hip bone. So if you're touching your hip bone, that area up there, that's where the lats are, and where our bony structure of the femur or down, that's called the trochanter, is, that's where the hip is, okay? The space between the iliac crest and the trochanter, that's what they call the hip dips, okay? So that is what we call hip dips, that most people like that filled in to get a rounder, fuller look in the hips. If we focus the fat transfer higher in the hip dip area, so this area, then we're achieving more of a lats look. If we are transferring more fat towards the bottom and keeping this top part smoother and rounding it more to meet your thigh, we're looking more to a hips or that upside down heart shape shape in the buttock, okay? Why is it that filling hip dips, it's hard or sometimes requires more than 1 round? It has to do with the blood supply, okay? So the baseline of fat transfer, moving one fat from one area to the other, relies on that fat surviving in that other area, right? It's like if you're moving a little flour from one pot to the other, you rely on that flour surviving in the new ground, okay? That flour needs to get roots again and set and get water and nutrients from that new ground to survive. It's going to look pretty at first, but if it doesn't survive from the nutrients and water that it grows on the new pot, it's going to die. Same thing as the fat, okay? The fat at first is going to look fine, but it needs to develop those roots, which are the blood vessels. And the blood vessels bring oxygen and nutrients, just like the flour needs to survive, okay? So in the buttock, we have a lot of blood vessels, okay? So just imagine the buttock is like a very rich ground that has all the nutrients, very well supplied with nutrients, water, everything, and the flour, it's like very easy to grow. Very easy to grow flowers there, okay? The hip dips is an area like a desert. Doesn't have a lot of blood vessels. So growing a flower in a desert is very hard, right? Because we don't have those nutrients. It's the same thing with the hip dips. It's an area that doesn't have good blood supply. So that's why even though you filled it and in the early post-op period it may look round and even, in the long run it might not, okay? So if you're looking for a very dramatic hip augmentation, I'm going to tell you from the get-go, you're probably going to need more than 1 round, okay? If you're looking for a more natural transition, filling the hip dips very mildly and rounding with proportion to your thigh, just keeping it more of a natural look, then yeah, most of the time with 1 round, you're okay, okay? Another thing that it's always very important to mention when I'm evaluating patients, and a concern for a lot of my patients, is the presence of cellulite and skin laxity in the buttock, okay? So what is cellulite, or the dimples that we see in our buttock? It's basically attachments from collagen that form between the muscle and the skin. And those create those dimples or those areas of indentation in the buttock. Those are basically a combination of diet, exercise, and also genetic, okay? So the number of dimples is very genetically driven. The problem with those is that sometimes with the fat transfer, we can kind of release some of them and make it seem a little bit better, but the problem with trying to be too aggressive with releasing those is, just imagine, that skin has already been stretched down, okay? If we release them very aggressively, then it pops and it fills with fat, and instead of having a valley, you have a little mountain. So a contour deformity or a blowout deformity on the buttock, which actually it's more noticeable even with clothing, okay? So that's why I can't be too aggressive trying to release those attachments, because solution to the problem might make it worse, okay? And that fat that I'm injecting, because I'm doing that at the same time as the BBL, right? So when I'm injecting the fat, that fat can accumulate in that little bubble, doesn't have good blood supply, and we end up with fat necrosis, or that fat dying and making a cyst that then may become hard, you can feel it, may become infected, causes other problems, okay? So that's the reason why we can't be too aggressive with cellulite during the BBL. So I always tell my patients, BBL, it's not a treatment for cellulite, okay? We may try to make it better, but trying to make it better but by being aggressive is actually worse, okay? The other important aspect of cellulite is that if it doesn't get better, it might actually get worse with the BBL. Why? Because the cellulite, like I said, it's an attachment. It's dimpling an attachment, right? If we fill with fat the rest of the buttock, then that attachment and that inclination or divot is going to be more noticeable because the rest of it is filled up, okay? So sometimes it may actually get worse, okay? What is my recommendation for cellulite? It's an injectable treatment, FDA approved, called Quo, okay? Quo is a medication recently approved by the FDA. We have it here available. And it's an enzyme called collagenase. So the word kind of resembles collagen because it breaks collagen. Okay, that's what the enzyme does. So it's an injection that you put directly in the dimple and breaks the collagen and causes that deformity to get better. Okay. The downside is that it's a 3-time treatment. Okay, so I understand for the patients that are from out of state, it's hard, but patients that are local, it's a very good alternative to Cellulite to create a better contour and smoothen the buttock and hip area. Okay, like I said, 3 treatments, 3 weeks apart. Okay, so if any of you guys are interested, you can send us some messages and communicate with our coordinators, but it's a very good option. Okay. The other thing is the skin laxity. The skin laxity sometimes makes the cellulite look worse. Okay. BBL is not a direct treatment for skin laxity, but if there's mild, very mild skin laxity, by filling it with volume, you can see that it may improve, okay? So sometimes those little dimples actually improve because they're actually skin laxity, deflated skin, that when we fill it with fat, it rounds and pops it, okay? And the most important part of this talk, surgery goals, okay? So the main question of my patient when she sent me the message was, how do you go with your patients to try to individualize the treatment or the surgery to get you to a particular goal, okay? And that, I think, is the most important part of my job, and I take it very seriously, because I do think that this is not something, any surgery, no breast, mommy makeovers, BBLs, liposuction, it's not, and that's what I love about plastic surgery. It's not that it's one surgery that I repeat constantly. It's a different surgery each time. I may be doing 3 BBLs and the 3 BBLs are completely different because of that conversation I had with you before, okay? So that goal discussion starts with your initial consultation, sending the pictures, okay? So that consultation will let me know what are the areas that you want to target, okay? And I evaluate the pictures and see what body type you have, and I give you recommendations regarding that body type, okay? It continues if you want to do a virtual, okay? So you can talk to your coordinator and we can do a virtual or an in-person consultation, and that way we can discuss ahead of time what are your goals again, and what is it that you're looking for specifically. And then we do it again in our pre-op consult. So the day before the surgery, when you come in, you do your physical exam, I check all of this, right? Your foundation, your body shape, your skin laxity, skin quality, fat availability, the distribution of fat. And I discuss specifically what are your goals, what is it that you're looking for with this surgery, and discuss one-on-one if it's something that it's reachable, if it's something that I can change, if it's something that it's obtainable, and also if you're going to need more than 1 round, right? And all that discussion, I have it with you. A very common concern is people saying, I don't want to wake up looking like disproportionate, or looking like I have a diaper butt, or looking like X or Y, right? I don't want to mention names, but you all know. But basically, that discussion is going to be extremely important. It's very, very difficult. I haven't seen it to create that look from a first round. The reason for that is that the amount of skin elasticity that needs to happen in the hip and buttock area to allow to inject that amount of fat, it's usually not possible, okay? Those looks were achievable when people were injecting in the muscle, okay? The muscle stretches a lot, okay? The skin does not stretch the same. Just the quality of the tissue is different. So when you're injecting in the muscle, you can inject large volumes of fat and create that very dramatic look, okay? But as we all know, that is not safe, okay? Injecting in the muscle can lead to fat embolism. That fat going into one of the veins in the pelvic region, traveling to your heart and lungs, and including the passage of blood, and it can be fatal, okay? So that's why it shouldn't be done anymore. It's actually illegal to do in Florida, and that is why the use of ultrasound is extremely important to make sure that you're injecting in the right plane, okay? The right plane is between the muscle and the skin, the subcutaneous space, okay? The subcutaneous space, it relies on stretching the skin, allowing that fat to be put in that space. If the skin doesn't stretch enough, then it's not gonna allow to reshape your buttock, okay? So that's the final thing in all the discussion. I always tell my patients this, okay? This is what we're gonna work towards. But I'm not gonna know how much your skin will stretch until I'm doing the surgery, okay? I can give you a guess estimate when I examine you, say, yeah, it looks like this. You have more skin laxity in the buttock hip area. I think I'm gonna be able to round this up. But the final way of knowing is when I'm injecting the fat in the operating room, okay? So there's always a limit of how much fat I can inject, and it's related to that, okay? So people with body shapes more constricted in the bottom, that already their waist is wider than their hips, yes, that's gonna require more than one round to get to a more hard shape or hourglass figure, because there's no way of stretching that skin that much to create that very wide hips from one round, okay? And the other question that I get a lot is like, but what's the difference if you stretch it? If you stretch it already to the max, what is the second round gonna do? Well, when you stretched it at the operating room, it gets to a maximum amount, but that skin is gonna settle and that skin is gonna stretch. And 9 months to a year later, that skin is gonna be, that volume is gonna be the new normal for that skin. So a year later, you can go ahead and stretch it again, okay? It's like gaining weight. It's like pregnancy, Like this amount of volume was not allowed to be there all of a sudden. Like you couldn't do this in 2 hours, but over a 9-month period, you can stretch that skin. It's the same concept, okay? Over time, the skin will stretch. It just won't stretch in 2-3 hours when I'm doing the procedure acutely, okay? So that's basically my discussion with the patients. I always welcome wish pics. I love it because wish pics tell me what you're thinking. Sometimes it's very hard to put it into words, but when you show me, this is what I mean, this is what I'm trying to describe, this shape, then I can tell you, yeah, this is something that we can achieve, or that's going to require more than one round, or that, or it's not achievable with your body shape. This is something that this person started here and you started here. So we can work towards that goal, but there's a limit of how much you can change the foundation and the anatomy of a person, okay? So I'll take some questions now if you guys have.
Yep. We have some here at YouTube. Say hi to...
Hey guys, thank you for watching from YouTube.
Okay, the first question is, what causes your hemo to go down after a BBL procedure?
Yeah, it's a very good question. So when you're doing a BBL, part of the BBL, or a very big part of the BBL, is the liposuction 360. So it's doing liposuction to the front, to the back, okay? So the front, basically the entire abdomen, the back, all the way up to like the bra area down to the lower back, okay? So liposuction is basically putting a cannula in the tissue and suctioning the fat, okay? I'm not going in and getting blood vessels to stop the bleeding. No, I'm using what's called tumescence fluid. Tumescence fluid is using one of these bags, which is normal saline, and we put a medication in called epinephrine. Epinephrine causes vasoconstriction or constricting of the blood. So when you're doing that procedure, it's not too much bleeding, but there's still going to be bleeding involved, okay? Because I'm suctioning the fat, okay? So there's always going to be bleeding involved with liposuction. The tumescent fluid limits that amount, but it's still going to be bloody. That's why there's a limit of how much fat I can remove in one round, okay? And that is why it's not safe to go in and in 2-3 hours remove more than 4 liters of fat when you're going home afterwards in an office-based surgery center, okay? So that's why the hemoglobin level is always going to drop. And that is why I always do cell saver with the cases, okay? What is a cell saver? The cell saver is putting that fluid, so the fluid that comes out, I let it settle, divide from the fat, because the density is different, and that fluid that separates from the fat, and they process it in the machine that basically takes the components of the blood, the red blood cells out, okay? Once those red blood cells are out, then in a sterile fashion, sterile bag, we reinfuse that to the patient to give that, it's like an auto transfusion, getting that back into the patient. It's not returning every single cell back, okay? So you're still gonna have hemoglobin drop afterwards, but it's just the amount. And the recovery is better, and the feelings of weakness, lightheadedness are a lot better when we do it this way, okay? So that's the reason hemoglobin drops.
Okay, I'm getting my wisdom teeth removed a month before my BBL with you. Is that okay? Star child.
So send us a message to Clara and we'll get back to you, okay?
Okay, so this is a comment, this is not a question, and Jasmine Rodriguez says the next time it's in Spanish, please, to understand everything. Let's do it next week in Spanish.
Let's do it, definitely. La semana que viene lo podemos hacer en español y hablamos de todo esto. Podemos hablar de BBLs, podemos hablar un poquito de todo general de BBLs, del ultrasonido, de la decisión de tomar cirugía y de todo eso. Seguro que sí.
Okay, do you ever use fat from thighs if there isn't enough anywhere else during the BBL?
Yes, definitely. So a very common concern in especially patients that are going for second round BBLs is that liposuction has already been done in the trunk, so there's not much fat available in the abdomen or back, okay? So one of my recommendations usually for these patients is gain weight and also add areas that you haven't had liposuction before. What are the common areas? Arms, so arm liposuction, and inner thigh is the other area. Definitely help bring that fat level a little bit higher so we have fat available to be transferred to the hip and buttock so you have a more noticeable result.
Okay, well, let's go on with another question that I have here. I'm sorry, Doug, this is too much fun.
That's okay.
Why do you lose fat after a BBL procedure?
So a common question is it a BBL? Is it temporary or it's forever? So the real answer is it's forever, but there is some fat that is lost in between, okay? So when you do a BBL, transferring fat, moving fat from one area of the body to the other, right? That fat needs to survive in that new area, okay? Not all the fat survives. Why? Because it needs to build those blood vessels, and the time is like that flour that I was telling you guys about, right? We move the flour from one pot to the other. Not all the oh my god, I blanked out. Not all las hojas. I blanked out.
The leaf?
The leaves. Not all the leaves are going to survive. The flower is going to lose some leaves, okay? And it might even like get a little bit more like ugly and sad, and then kind of get back up, right? So it's the same with the fat. It's not all the leaves are going to survive. So how much fat survives after a BBL? It depends, but usually 70 to 80% survives. So that means you're going to lose 20 to 30%, okay? The other reason why you're going to see a change from the initial post-op period to the final result is because there's swelling involved, okay? So before, in the early post-op period, the bottom looks very full, the hips look very sometimes even bigger than what the patient wanted. They're like, oh, this is too big. It's like, okay, that's gonna settle. And when we say settle is you're gonna lose some fat and the swelling is gonna come down, okay? But once that fat settles and survives, okay, talking about 3 months out, okay? 3 to 6 months out, once that fat is there, that fat is yours. And it's there to stay. But like all our fat in our body, if you gain or lose weight, that fat is going to increase or decrease its size, right? So if you gain weight after your BBL, you're going to see an increase in the buttock and the hip area, okay? If you lose weight, then you're going to see a decrease in the size of your hips and buttock.
Okay, listen. This is a long question. This is,
Okay.
can you do a breast lift with reduction, a tummy tuck, and lipo to the inner thighs and arms all at once?
Okay, so it depends on the amount of fat that we're talking about. So it depends on your BMI. Okay, and I'll explain a little bit about that. The breast lift, breast reduction combined with a tummy tuck is basically a mommy makeover, okay? A mommy makeover, it involves liposuction to the flanks, okay? Which is basically the waist region, okay? When I'm combining a procedure like a mommy makeover, tummy tuck, breast procedures with liposuction, there's a limit of 1 liter of fat removal, okay? And that is because I'm operating in an office-based center in the state of Florida, and the Department of Health in Florida limits that amount of liposuction for safety reasons because you're going home afterwards, okay? I'm not in a hospital. And combining all those surgeries with massive liposuction, it may be detrimental to your health, right? So it's for safety reasons. So when I'm doing that, it's 1 liter of fat, okay? So if you're a very high BMI patient, higher than 30, let's say, because I'm doing BMI up to 33.5. So if you're more like, let's say 32, 33 BMI, then I would advise you to focus in one area of liposuction, right? Because when we're putting a lot of areas of liposuction, then that adds up to that liter, okay? But if you're in the lower BMI range, let's say 25 to 30, and it's very little fat from the thighs and the arms, then yeah, we can combine those, okay? How's the best way for you to find out? Sending the pictures, filling the virtual consultation online, and I can let you know if you're a candidate or not.
Okay, how long after a BBL, if the fat stays?
Usually 3 to 6 months after. So 3 months, you'll see a final result. 3 months, you may start to see what the fluff fairy or the fluffing period is, okay? So what's that, right? So the fat settles, the fat survives. You start feeding the fat with healthy fat diet. You can see that the fat cells may increase the size, okay? So that's the fluffing. So at that period, that fat survived, that fat is there, okay? So 3 to 6 months, that's a good time to see a final result.
Is it true is the 70% of fat? I don't know of what, but I think it stays in the body. I think
yeah,
sugar.
Yeah. So it's usually 70 to 80% what stays in the buttock, the fat transferred. So that's what survives. You lose 20 to 30%.
Okay, let's go to this chat. We have more. I think this is too long because they asked you explain the process of a BBL combined with a tummy tuck.
Okay.
But maybe you can what's first and what's later.
Yeah. So I usually do not combine those two procedures, okay? There's safety reasons why I don't combine them, which go along my previous explanation of when I'm combining a tummy tuck with liposuction, I can only remove 1 liter of fat, okay? So removing 1 liter of fat, 1 liter is not going to significantly change your shape when I'm transferring that. So I don't think it's worth transferring 500 and 500 to each buttock because you're not going to see a major difference or a difference most of the time at all, okay? So that's a safety reason, okay? Because I can't do more liposuction on you when I'm doing a tummy tuck. And also, when I'm doing a tummy tuck, I don't do liposuction to the front of the abdomen. The reason for that is because I'm elevating the skin to do the muscle repair, okay? So that skin now survives from the blood vessels that are in the subcutaneous space. So if I go ahead and do liposuction to that area, you can have skin necrosis, skin dying, and in the bottom of the incision, where the incision is, okay? So that's the thing that I don't do it, and that is one of the main reasons I don't combine liposuction 360 BBL with a tummy tuck. And the second main reason is recovery, okay? I want to maximize your results, okay? So to maximize your tummy tuck result, being very tight, I'm gonna ask you to be sitting, like sleeping on your back, bent, so you don't have extra tension on the incision. And then to maximize your BBL results, it's actually the opposite. I'm gonna ask you to be sleeping in your belly, okay? So you don't put pressure on the buttock and hips. So it's basically the opposite recovery plan. So I don't really see a way of maximizing both surgeries and having a good recovery for both.
Okay, I think we're ready.
We're good?
Yes, I think we are.
We are good. Awesome. So thank you so much for joining. I hope this answered most of the questions regarding that that decision making. How do I discuss the goals, expectations, and what is that we call the foundation and the shape, and how does it affect the results? Okay. Again, everybody's different, and we like baseline before any procedure, cosmetic procedure in our body. We should start by getting acquainted and getting happy with ourselves, getting us being in a state that we are happy, but we want to change this or that specifically. If you're not happy with your body and you don't accept your foundation, then you're never going to be happy with your results. And I think that's something very personal and very very important, that each patient that goes through this process understands that there's a limit of plastic surgery, and there's a limit of how much a body can change. There are things we can change, but the baseline and the starting period is you need to love your foundation and who you are. And yes, we can change some things and tailor some things and improve, enhance. But baseline, you have to love your body, okay? Hopefully this helps. I'll see you guys next week on Tuesday Tips.